Hello, my name is emilystaley. I am an LPN to BSN student at Indiana State University. This is a health project. It's health education project number 5 for my community health nursing class. I'd like to discuss premature babies. As you probably know by now, I was a pediatric nurse for 7 years. So my focus a lot on these populations at risk has been around pediatrics and gestation. Learning objectives. Upon completion of this presentation, the viewer will be able to list 5 health dangers premature babies are at risk for, state 5 common causes for premature births, define what is a premature infant, identify healthcare policies that can create better outcomes for premature babies, and discuss differences, values, preferences, and expressed needs with an awareness of how personal values and beliefs can impact care to premature infants and their families. Please stop now to take the pretest to assess your prior knowledge about premature babies. The pretest can be accessed by clicking the link titled Pretest in the description of the YouTube video below. First, let's discuss what is the definition of a premature infant. A premature baby is an infant who is born before 37 weeks of pregnancy. There are different levels of preterm infants depending on the number of weeks gestation they are born within. Late preterm is a baby born between 34 and 36 weeks of gestation. A moderately preterm baby is born between 32 and 34. A very preterm baby is born at less than 32 weeks of gestation, and an extremely preterm baby is born at or before 25 weeks of gestation. Unfortunately, those extremely preterm infants have the highest rate of mortality and are at higher risk for future health issues if they survive infancy. However, all premature infants are at risk for severe illness, deficits, and death. What health problems are premature babies at risk for? We see anemia, infections and sepsis after birth, necrotizing enterocolitis, acute kidney injuries, hearing impairments, cerebral palsy is very common, autism spectrum disorders are also very common, mental retardation, chronic health issues into adulthood such as diabetes, dental issues, jaundice, and the treatment of jaundice is necessary at times, poor growth, vision problems, suckling and feeding issues. A lot of premature babies require tube feedings for multiple months after birth. And then pulmonary issues, this is very common. There's always a risk for breathing issues with premature babies. Apnea of prematurity, bronchopulmonary dysplasia, and respiratory distress syndrome are a few they can have. Which pregnancies are at a higher risk for premature birth? A lot of these have to do, well, all of them have to do with the mother and their pregnancies for this infant. Issues such as the mom has chronic health conditions, she uses drugs or alcohol during gestation, she has a multiple pregnancy such as twins or triplets, she has preeclampsia, a mother who has problems with her uterus or cervix, a mother that became pregnant less than 18 months since her previous pregnancy are at risk, Experiences with vaginal bleeding or infections during the pregnancy put them at risk. African American mothers under the age of 20 or over the age of 40 are at a higher risk. Mothers that have family or personal history of preterm births. Mothers that use tobacco during pregnancy. Mothers that were underweight prior to gestation. Mothers experiencing serious life stressors such as death or loss. Mothers experiencing physical trauma or injury, and also mothers who have already had multiple miscarriages and or abortions. So now that we've discussed risk factors, health risks, definitions, let's consider some healthcare policies that can create better outcomes for premature babies and their mothers. Huge one, as a lactation consultant myself, I've learned to understand that encouraging chest to chest or even chest to back, skin to skin contact immediately after birth or as soon as appropriate to reduce the risk of hypothermia. Sometimes those babies have to be placed into an incubator immediately after birth, but as soon as they can possibly have that skin to skin contact with their mother is crucial. We're also discussing more frequent APGARs or more than 2 APGAR scores in the first hour of birth to appropriately measure the need for any further emergent medical treatment. Normally, APGARs are taken at 1 minute and then 5 minutes after birth. But let's consider premature infants. It might benefit them to have an APGAR score in between minutes 1 and 5 and even later at 10, 15, even an hour later. Obviously, the nurse needs to be taking frequent vital signs. Doing an ECG and an ultrasound of the brain right after birth is crucial. And also introducing a lactation consultant within the first few hours of birth, even if the baby is on tube feeds. This will help the mother maintain confidence in breastfeeding and supply her with the education she needs to prepare for feeding a premature infant. Introducing that lactation consultant, despite incubators, tube feedings, anything, is crucial to when they finally get to go home and have that mother-baby experience of breastfeeding. So now let's consider differences, values, preferences, and expressed needs with an awareness of how personal values and beliefs can impact families of premature babies. Having a premature infant causes significant stress on the mother and the family. Different cultures possess stress and handle stress in very different ways. The nurse needs to understand any actions and choices that are different from their own in order to help their family care for the infant to the best of their ability during this difficult time. Having a premature baby puts the infant at risk for developmental, mental, and physical disabilities. Certain cultures see these disabilities in multiple different ways, and they tend to cope with them significantly different than others do. The nurse must understand the family's fears and concerns due to their culture and their beliefs and seek appropriate education and resources for the family and their culture. As we have learned as nurses, certain cultures do not accept certain medical practices such as blood transfusions or vaccines. However, we must remember there is a fine line between allowing the family to deny care due to these beliefs and also reporting neglect. Education and advocacy from the nurse is crucial in helping these families understand the importance of some of these medical practices. Thank you for watching the presentation. Please take the post-test to gauge how much you've learned about this population at risk since the beginning of the presentation. Click the link titled Post-Test in the description of the YouTube video below.